I'd like to spend a few minutes talking to you about metabolic syndrome. If you're constantly feeling tired, if you're gaining weight even when you're really not eating that much, if in the past your doctor has told you that your labs might not be the best, it's not that you're just getting older. You may be dealing with something far more serious. I'm Dr. Stile, and today I'd like to talk to you about something I see frequently in my patients who are struggling with weight gain, fatigue, or stubborn belly fat. It's called metabolic syndrome. This is not just the latest buzzword. It's real, it's silent, and it's a health threat that affects nearly 1 in 3 adults, and most of them don't even know they're affected by it. So what exactly is metabolic syndrome? It's not a disease or one disease. It's a dangerous combination of conditions including high blood pressure, high blood sugar, abnormal cholesterol levels, and excess body fat, especially around your waist. Alone, these things don't always seem like a big deal, but together they may increase your risk for heart disease, stroke, and type 2 diabetes. Here's the kicker. Metabolic syndrome doesn't show up overnight. It creeps up slowly, kind of like a slow glacial drift. You start to feel a little more tired, you can't drop weight like you used to, and your cravings, especially for sugar, spike. Often, you brush it off as stress-related or related to advancing age. But meanwhile, your body is actually crying for help. So let me break it down for you in even more exact terms. If you have 3 or more of these 5 findings, you may be already struggling with metabolic syndrome. If your waist size is over 40 inches for men or 35 inches for women, that's 1. 2, if your blood pressure is 130 over 185 or higher, or you're already taking blood pressure meds, 2. If your fasting blood sugar is over 100, 3. Triglycerides over 150, 4. Or your HDL, the good cholesterol, is under 40 for men or 50 in women, you have metabolic syndrome. Now here's where it gets serious. This condition drastically raises your risk for heart attacks, stroke, and even fatty liver disease. Believe it or not, you can look good on the outside and still have it. In other words, you can be thin and still have insulin resistance or elevated blood pressure. This isn't just about your weight or your appearance. It's about your body and what it's doing on the inside at the metabolic level. And unless it's caught and treated early, it keeps building momentum, silently pushing you closer to a major health event. Addressing metabolic syndrome isn't just about cutting calories or going to the gym. It's more. It's about treating the root causes, often with medical weight management and lifestyle support. Once you address the real issue, everything else becomes easier. Weight loss, energy, sleep, even your mood. Remember, metabolic syndrome doesn't announce itself with flashing lights, bells and whistles. You may not even have any major symptoms. Metabolic syndrome hides in plain sight, but if you know what to look for and you take action early, it can be reversed. You don't have to live in a constant state of fatigue, frustration, or just getting by. There's a better way. It starts with your understanding of what your body is really trying to tell you. Here at Dr. Stile RX, we have the tools and support to help diagnose and treat the conditions that contribute to metabolic syndrome. So schedule a consultation with us now and let's figure out what's really going on. Until I see you next, be well.